All right, today we're talking about Catholic calisthenics and joint mobility. So when we think about flexibility or stretching, we want to focus on two things. Number one is a joint or body part, and then how that joint behaves or moves within an entire movement pattern. All right, so just like the church, we are all individuals. We're all beloved children of God as individuals, as unique people. But then we come together in communion. We come together as a Catholic community, all right, to form the Catholic Church. All right, in the same way, all right, we have an individual joint, our ankle joint, our knee joint, our hip joint, that then comes together to form a community, to form a pattern when we want to move, to do some of the Catholic calisthenics we talk about, such as genuflecting or squatting. All right, so we want to appreciate the individual joint, but then how does that work within a pattern, such as getting up and down from a chair? So today we're going to talk about the knee joint, okay? So the knee joint, it's made up of your thigh bone, your shin bone, and then the side shin bone, your fibula, okay? This is your femur for the anatomy students in the room. And then you have your kneecaps, the kneecap sticking out, your patella, and then your tibia. And then you have your fibula here, okay? So those four bones essentially make up the knee joint. So we think of the knee joint just flexing and extending like so, all right? But then there is a little bit of a rotational component. The knee joint is a little more compressed like this when we're standing, and so when it rotates or flexes and extends, that's where we get some of that grinding of that cartilage and that meniscus. So if you're over the age of 40 maybe, you're going to start getting some degeneration in their joints, and that's when you think about arthritis or something. It's on the surface of this bone here, typically where the meniscus are, that gets a little arthritic, gets a little ground up, and then you just get a little friction popping and things like that. So what we think about then is that we want to work on the pattern of doing a genuflect or a squat, a knee bend, okay? But we need to take care of these joints. So how do we do that? Today we're going to talk about the knee joint in particular, and just a simple movement joint mobility exercise that I love to do for the knee. Which will take into account the kneecap that we want to move around well. It doesn't move on this particular skeleton, this model. We're going to move the knee joint in flexion and extension, but we're also going to do some slight rotation as well, and that will involve this fibula, which needs to move as well. All right, so that's what's key. See, there's been a lot of discussion. Matt Fred, for example, talked about yoga recently. Unfortunately, in our secular world, when you think about flexibility, so many people come to me and say, I just feel tight, feel stiff. Should I do yoga? And even on my secular side, my personal training business, I say, you can if you want, but that's not the only alternative. That's not the only option for flexibility training. We can do a lot with your entire body. So that's what I focus on as a fitness professional, but also especially in my Catholic Fit programming. So let's stop talking and get into the knee joint. What I want you to do, you can either sit down, if you can pick up your leg, maybe you can put a pillow under your leg to do this. Well, actually, let's start this. Sorry. Let's start seated. Your leg has to be straight here first. So whatever position you can kind of get into, if you need to lean back against the wall maybe, but you want your leg to be totally relaxed, because what I want to do is I want to take my kneecap and move it around. So find your kneecap here, all right, and to move it around. And just find it first. Explore that a little bit. Can you push it left and right? Can you push it forward and backwards? Be very gentle. If you press it down towards your foot, and you compress it a little bit, you are going to get a little bit of a pop or grind there. That's perfectly normal, okay? Especially if you are over the age of even 30 or 40. All right, so what we want to do is just mobilize that some. Now, you can either spend a certain amount of time. You can say a Hail Mary if you want to do some sort of time or prayer like that. I like to do repetitions of 7, right? I think of 7 times 7. I think of forgiveness. And so I'm going to do something like maybe back and forth 7 times. All right, left and right. So I'm just have a thumb on each side of my kneecap, and I'm just pushing it left and right. Then I'm going to push it forward and backwards, meaning down towards my foot and back up towards my hip. About 7 times. Sometimes I'll do 14, so 7 times 2. And then I'm going to do some circles. So I might do 7 clockwise circles, and then 7 counterclockwise circles. It might feel a little funky at first, but it's good to get some mobility in here just to see how's that kneecap moving. It should be pretty mobile, all right? If you have not done this in decades, be gentle at first. Eventually, you'll start getting some movement in there, all right? So that's just some kneecap patella movement. Make sure you have some joint mobility there, because that kneecap is going to sit on top of your joint like so, and if you move your quadricep muscle, all right, and maybe in rehab or physical therapy, you've done something called a quad set where you tighten your quadricep. That kneecap needs to move up and down. And if it doesn't, or if it's not tracking correctly, it ends up grinding away at the back of your kneecap. We call that chondromalacia, maybe PF, patellofemoral pain. You might hear a diagnosis like that. It just means that that kneecap is either rotated and then moving, or it might be tilted or something like that. So we just want some mobility there. Now, after you've done that, I'm going to bend my knee and kind of hold it like so. So if you do this in a chair, leaning back on a seat, wherever you're most comfortable, leaning back on the wall. And what I want to do is just get that traction first. Now that's going to provide a little traction with the joint. I want some joint space. I want to take those bones and just kind of space them out a little bit. And after I do that, what I want to focus on doing is, can I take my tibia and turn it in and then out? So with my model again, I'm going to try to turn it this way and this way. That's kind of my goal. It doesn't matter if it's moving just a millimeter or if you're getting some good mobility there. Just think about moving it and don't move your foot as much. Now your foot, ideally, your ankle will turn out about 45 degrees one way, 30 or 45 degrees the other way. But think about your shin bone rotating in and rotating out. So just do that a few times. First, again, you can do 7 per side. How many times should we forgive our brother? So in and out. All right, if you want to do 49 times, get crazy. Then what you can do then is rotate out, and now what we're going to do is we're going to add a little flexion extension. So flexion extension of the knee is here and back. All right, that's extension. Out, flexion back in. So what we want to do is rotate out, extend, rotate in, and then flex. Stay there. Stay internally rotated in, extend, rotate out. And so again, you can do the best job you can at this. If you're seated in a chair, if you're leaning back on a wall, if you're sitting in bed, maybe the side of your bed, if you just have your leg off the floor, off the side of the bed, you can do that. That's more comfortable, and down. So really turn as far as you can and go up, turn out as far as you can, and then go back down. All right, then up, rotate in and out. So what we're trying to do, and also what you could also do is as I go up, as I pull out, sometimes I pull back on that fibula. Like I want that side bone to kind of move with me. I can move that out and then down. So again, what we're doing is not only getting flexion extension, which we need for walking, jogging, genuflecting, but we also get some of that rotational component, which is so important. When you extend your knee all the way, it has what we call a screwing mechanism that not only does it extend all the way, but there's a little bit of rotation that just kind of screws it into place, and that helps provide stability within the knee joint. And you have a little muscle that's in back of the knee that runs kind of diagonally back of the knee that helps unlock it, and then it bends again. Okay, so your knee might be locking for different reasons. If you have a little meniscus tear, you might feel a little bit of a catch walking downstairs. If you have a little soreness in the back of your knee, it may throw off that unlocking and locking mechanism, which you may have a hard time extending your knee all the way or not. So we're just trying to loosen up all those things. So that's a great joint mobility exercise to start with. Just again, gently start with your kneecap and then rotate in and out. And then, and again, try to just rotate from your knee, not your entire hip, and then rotate out, extend, rotate in, and back, all right? Out, and just kind of go through that whole motion and knock out, again, maybe 7 each direction, 14 total, all right? That, again, is isolating that knee, mobilizing that knee joint, and then when we go to genuflect, that knee comes into play with the rest of the body. So each time I'll do a few videos like this, we're going to talk about the ankle joint, the toes, we'll talk about the hip joint, and run up and down the body, okay? And then the entire joint by joint philosophy as well, all right? So God bless you. Keep moving. I want to save the genuflect. You know, we got to be genuflecting more in church. Everybody's bowing because they have given up on the genuflect. Let's get that back, all right? God bless you, and I'll see you next time.